Good evening to all. Thank you, organizers, for this opportunity. So I'm going to present a very important abstract. This is one abstract, I think, which is going to make a lot of clinical decisions for the patients. This is a full publication from JCO. The lead author is Professor Martin Rick. So this is the 5-year outcomes with Pembrolizumab versus chemotherapy for metastatic non-small cell lung cancer with PD-L1 TPS score of at least 50%. So we know that Keynote 024, this is the clinical trial which is the publication based on. It is the first phase 3 study that shows superiority of immunotherapy. Subsequent overall survival analysis has shown improvement in the overall survival, which persisted. This is a 5-year survival analysis, and it is to be noted that previously there is limited data of 5-year survival for lung cancer patients for a reason. This is a poor prognostic subgroup, and recently we are using immunotherapy and we are finding patients living beyond 3 years. So this is the limited data set, and this is what we are going to discuss today. 5-year survival is important landmark for cancer treatment, and definitely we are going to look into this very interestingly. So coming to the study design, it is a phase 3 randomized open label study. Patients with non-small cell cancer with patients with PD-L1 TPS of at least 50% being random of the control arm or the experimental arm. Experimental arm is Pembrolizumab 200 mg dosed at 200 mg every 3 weekly, up to 35 cycles. Active brain metastases were not included in this clinical trial. As you can see, patients continued the drug up to progressive disease or unacceptable toxicities. An important thing to note is that patients who are on platinum doublet chemotherapy could actually cross over to Pembrolizumab at the time of progressive disease. Primary endpoints are PFS, and secondary endpoints are overall response rates, overall survival, and safety. So these are the patient demographics and baseline clinical characteristics. If you look at the first two columns, these are the cohorts which we are going to discuss. There is nothing much to really discuss here. They are equally matched across the several characteristics. And we can see the third column, which is the 35 cycles of Pembrolizumab. Actually, 39 out of 154 patients who are randomized to Pembrolizumab could actually complete the 35 cycles of Pembrolizumab. And here also, we couldn't find any, investigators couldn't find any particular clinical characteristics that could define these patients. So we'll come into the other details in subsequent slides. So these are the clinical characteristics, patient characteristics and treatment. Out of 305 patients, 154 randomized to Pembrolizumab, 51 randomized to chemotherapy. The median treatment duration was nearly 8 months in Pembrolizumab, around 3.5 months for the chemotherapy group. Again, patients who have been assigned to chemotherapy, nearly 66% of the patients have been crossed over to one form of the immunotherapy as well. In Pembrolizumab group, nearly 50% of the patients would actually receive further anti-cancer therapy, including 12 patients who received second course of Pembrolizumab on study. These are the survival outcomes. If you look at overall survival graphs, at the time of median follow-up, we can see that Pembrolizumab had a lesser amount of overall survival events at 66.9% compared to chemotherapy, which is significantly higher at 81.5%, making the hazard ratio of 0.62, a statistically significant hazard ratio. And coming to the median numbers, 26.3 versus 13.4 months, an absolute difference which is more than 1 year compared to platinum-based chemotherapy. If you can look at the 3-year and 2-year, 3-year, and also 5-year estimates, 31.9% at 5-year overall survival estimates versus 16.3, almost actually more than doubling. And similar numbers in PFS. The hazard ratio of PFS is even better, 0.50. Medians are at 7.7 months versus 5.5 months. And at the end of 5 years, the estimates are 12.8% versus not reachable. These are the efficacy outcomes in the intensive treated population. If you look at the exploratory analysis, median overall survival for those patients who actually had a best response of stable disease alone, it was 21.1 months in the Pembrolizumab group versus 14.5 months in the chemotherapy group. This is one apprehension we clinicians usually have. That somebody is paying so much money for that drug, we are expecting responses. So these are the subset of patients who didn't had a response. The best response is actually stable disease. Even there, the Pembrolizumab group done better than the chemotherapy group. And in those patients who had treatment-related adverse effects, the overall survival was 35.9 months and 5-year estimates were 35.1%. Even PFS2, which was defined as time for randomization to subsequent disease progression after the initiation of new cancer treatment or death from any cause, it was 24.1 months in Pembrolizumab group versus 8.5 months in the chemotherapy assigned group. These are the objective responses. If you can see, 46% versus 31%, objective response rates. There are at least 7 patients who had complete response, making a percentage of 4.5%. What is more important to note is that those patients who are actually responding, duration of response is 29.1 months versus 6.3 months, an absolute difference of more than 2 years. So this is a very interesting subgroup, outcomes in patients who completed at least 2 years of pembrolizumab, that is 35 cycles of pembrolizumab. Nearly a quarter of patients would actually complete on the study, and median time to completion is around 34.7 months. Probably these patients had a very smooth course. Baseline characteristics, unfortunately, investigators couldn't find any particular characteristic that can select out these patients. At the end of 3 years, the overall survival rates for these patients is outstanding 81.4%. And nearly 50% of patients were alive without progressive disease or on subsequent treatment for non-small cell lung cancer. Coming to the safety, again, at the long-term follow-up, there is no safety signal that is identified. And coming to the adverse effects, nearly 3/4 of the patients had actually had some amount of adverse effects who received pembrolizumab, 90% for those patients who received chemotherapy, and treatment-related adverse effects that are serious and grade 3 and more are 22.7% in pembrolizumab and 20.7% in the chemotherapy groups. So these are the very important conclusions. The 5-year overall survival of 32% is absolutely outstanding, and it is approximately doubling compared to that of platinum chemotherapy at 16.3%. Median overall survival was more than 1 year longer at 26.3 months versus 13.4 months, and magnitude of effect is still persistent despite nearly 2/3 of the patients from the chemotherapy group being crossed over to pembrolizumab. Again, safety is probably there, and long-term efficacy of pembrolizumab further demonstrated analysis in 39 patients who completed 35 cycles of pembrolizumab. 82% of these patients were alive with data cutoff, and 46% of patients are alive without progressive disease or subsequent treatment. And that concludes my talk. Thank you very much.